Welcome to the Full Freedom Life channel. Watch this video on the impact of Alzheimer's disease in America. Click like and subscribe and learn to live simply, healthy, and happy every day. Alzheimer's disease is a progressive neurological disorder that affects the brain, primarily impacting memory, thinking, and behavior. It is the most common cause of dementia, a term used to describe a decline in cognitive function and the ability to perform daily activities. Key characteristics of Alzheimer's disease include the formation of abnormal protein deposits, amyloid plaques, and tau tangles in the brain, along with the loss of connections between nerve cells or neurons and the death of these cells. Over time, these changes lead to the gradual deterioration of brain function and the worsening of symptoms. The exact cause of Alzheimer's disease is not fully understood, but it is believed to involve a combination of genetic, lifestyle, and environmental factors. Advanced age is the most significant risk factor, with the majority of cases occurring in individuals aged 65 and older. However, early onset Alzheimer's can affect individuals in their 40s and 50s. The symptoms of Alzheimer's disease typically develop slowly and worsen over time. Early signs may include forgetfulness, difficulty remembering new information, challenges with problem solving and planning, confusion, disorientation, and mood or personality changes. As the disease progresses, individuals may experience severe memory loss, difficulty speaking and understanding, inability to recognize loved ones, and a decline in physical and self-care abilities. There is currently no cure for Alzheimer's disease. However, treatments and interventions can help manage symptoms, slow disease progression, and improve quality of life. Medications may be prescribed to manage cognitive symptoms and behavioral changes, while therapies such as cognitive stimulation, occupational therapy, and lifestyle modifications, including a healthy diet and regular physical exercise, can provide support and enhance overall well-being for individuals with Alzheimer's. Alzheimer's disease has a significant impact on the health of American people, both for individuals diagnosed with the disease and their caregivers. Here are some ways in which Alzheimer's disease affects health. Number 1, cognitive decline. Alzheimer's disease leads to progressive cognitive decline, including memory loss, difficulty with problem solving and decision making, language impairments, and challenges with attention and concentration. These cognitive impairments significantly impact an individual's ability to perform daily activities and maintain independence. Number 2, functional limitations. As the disease progresses, individuals with Alzheimer's may experience difficulties with activities of daily living, ADLs, such as bathing, dressing, eating, and toileting. They may require assistance and care from family members, caregivers, or healthcare professionals. Number 3, emotional and behavioral changes. Alzheimer's disease often brings about mood changes, including increased irritability, anxiety, and depression. Behavioral changes such as agitation, aggression, and restlessness can also occur. These changes can affect an individual's overall well-being and place a burden on their caregivers. Number 4, increased caregiver burden. Alzheimer's disease places a significant burden on caregivers who may be family members or friends. Caregivers often experience high levels of stress, fatigue, and emotional strain due to the demanding nature of providing care, managing challenging behaviors, and witnessing the decline of their loved ones' cognitive abilities. Number 5, healthcare utilization and cost. Alzheimer's disease requires extensive healthcare utilization, including frequent medical visits, specialized care, and medications. The financial burden of Alzheimer's can be substantial, both for individuals with the disease and their families, contributing to healthcare costs in the United States. Number 6, impact on quality of life. Alzheimer's disease has a profound impact on an individual's overall quality of life. The progressive loss of cognitive abilities, independence, and social connections can lead to feelings of frustration, isolation, and a diminished sense of self. Number 7, comorbidities and increased vulnerability. Individuals with Alzheimer's disease may be more vulnerable to other health conditions and a higher risk of developing complications such as infections, falls, and malnutrition. Coexisting health issues can further compromise their overall health and well-being. Like this video so far? Then click like and subscribe to the Full Freedom Life channel to learn how to live simply, healthy, wealthy, and happy every day. While there's no guaranteed way to prevent Alzheimer's disease, there are certain lifestyle choices and habits that may help reduce the risk or delay onset of the disease. Here are some tips. Number 1, engage in regular physical exercise. Regular exercise has been linked to a reduced risk of Alzheimer's disease. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, along with strength training exercises. Number 2, follow a healthy diet. Adopt a balanced and nutritious diet that includes fruits, vegetables, whole grains, lean proteins, and healthy fats. Consider the Mediterranean diet, which has been associated with a lower risk of cognitive decline. Number 3, challenge your brain. Keep your mind active by engaging in mentally stimulating activities. Read books, solve puzzles, learn new skills, play musical instruments, or engage in activities that require critical thinking. Stimulating your brain may help build cognitive reserve, which can potentially delay the onset of Alzheimer's disease. Number 4, maintain social connections. Stay socially active and maintain strong relationships with family and friends. Social engagement has been linked to better cognitive function and may help reduce the risk of Alzheimer's disease. Number 5, get enough sleep. Aim for 7 to 8 hours of quality sleep each night. Poor sleep patterns and sleep disorders have been associated with an increased risk of cognitive decline. Number 6, manage chronic conditions. Take steps to manage chronic conditions like diabetes, high blood pressure, and high cholesterol. These conditions can increase the risk of Alzheimer's disease, so it's important to work with your healthcare provider to control them effectively. Number 7, stay mentally and emotionally healthy. Manage stress levels and seek support when needed. Chronic stress can have negative impact on brain health, so finding healthy ways to cope with stress is crucial. Protect your head is number 8. Take steps to prevent head injuries. Wear seat belts in cars. Use helmets when engaging in sports or activities that pose a risk of head injury, and make your home environment safer to prevent falls. Number 9, limit alcohol consumption. Excessive alcohol consumption can increase the risk of cognitive decline and dementia. If you choose to drink alcohol, do so in moderation. Guidelines recommend up to 1 drink per day for women and up to 2 drinks per day for men. Number 10, quit smoking. Smoking has been linked to an increased risk of cognitive decline and Alzheimer's disease. If you smoke, consider quitting and seek support if needed. In conclusion, Alzheimer's disease has a profound impact on the health of American people. It affects individual cognitive abilities, independence, and overall well-being. Additionally, it places a significant burden on caregivers and exerts pressure on the healthcare system and society as a whole. Addressing the challenges posed by Alzheimer's disease requires increased research, support services, early detection, and access to quality care to improve outcomes for individuals affected by the disease and their caregivers. Thank you for watching. Like, subscribe, and click the notification bell for more updates and for more upcoming videos. Till next time, bye-bye for now.